Strep throat is a common bacterial infection that affects the throat and tonsils. It is caused by a specific type of bacteria known as group A Streptococcus, gas, scientifically called Streptococcus pyogenes. This illness occurs most often in children and teenagers, but adults can also be affected. Strep throat spreads easily, especially in crowded environments such as schools, daycare centers, and households. If left untreated, it can lead to serious health complications, making early diagnosis and treatment very important. Causes of strep throat. Strep throat is caused by infection with group A streptococcal bacteria. These bacteria are highly contagious and spread through respiratory droplets when an infected person coughs, sneezes, or talks. The bacteria can also spread by sharing utensils, drinking from the same glass, or touching contaminated surfaces and then touching the mouth or nose. Poor hand hygiene increases the risk of transmission. Unlike viral sore throats, strep throat is strictly bacterial, which is why antibiotics are effective in treating it. Signs and symptoms. The symptoms of strep throat usually appear suddenly and can be severe. Common symptoms include a sore throat that causes pain while swallowing, red and swollen tonsils, and white or yellow patches on the tonsils. Many patients experience fever, headache, body aches, and swollen lymph nodes in the neck. Children may also have nausea, vomiting, or stomach pain. Unlike viral throat infections, strep throat typically does not cause coughing, runny nose, or sneezing, which helps distinguish it from the common cold. Diagnosis of strep throat. To accurately diagnose strep throat, a healthcare provider performs a physical examination and may take a throat swab. The swab is tested using a rapid antigen detection test, which can provide results within minutes. If the rapid test is negative but symptoms strongly suggest strep throat, a throat culture may be done to confirm the diagnosis. Accurate testing is important because symptoms alone cannot reliably distinguish strep throat from viral infections. Treatment and management. Strep throat is treated with antibiotics, most commonly penicillin or amoxicillin. For patients allergic to penicillin, alternative antibiotics such as azithromycin or cephalexin may be prescribed. Antibiotic treatment helps reduce the duration of symptoms, prevent the spread of infection to others, and lower the risk of complications. Patients usually start feeling better within 24 to 48 hours after beginning treatment. Along with antibiotics, rest, warm fluids, throat lozenges, and pain relievers such as acetaminophen or ibuprofen can help relieve discomfort. Complications of untreated strep throat. If strep throat is not treated properly, it can lead to serious complications. These include rheumatic fever, which can damage the heart, joints, and nervous system, and post-streptococcal glomerulonephritis, which affects the kidneys. Other possible complications include ear infections, sinus infections, abscesses around the tonsils, and the spread of infection to other parts of the body. Completing the full course of antibiotics is essential to prevent these outcomes. Prevention of strep throat. Preventing strep throat involves practicing good hygiene. Regular hand washing with soap and water is one of the most effective methods. People should avoid sharing food, drinks, or personal items with others, especially those who are sick. Covering the mouth and nose when coughing or sneezing helps reduce the spread of bacteria. Infected individuals should stay home from school or work until they have been on antibiotics for at least 24 hours and no longer have a fever. Conclusion. Strep throat is a common but potentially serious bacterial infection of the throat. While it is easily spread, it can be effectively treated with antibiotics when diagnosed early. Recognizing the symptoms, seeking proper medical care, and completing the prescribed treatment are key steps in recovery and prevention of complications. With good hygiene practices and timely treatment, the risks associated with strep throat can be significantly reduced.